Hi there. Welcome to Anima T1D. My name is Susan. My daughter Mia has type 1 diabetes.
My name is Dr. Shruti Ahuja. I am Mia's endocrinologist. In this video, we will learn more about lipohypertrophy, what it is and how it affects diabetes management. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you. Mia looks great. I don't see any scar tissue on her belly or arms. Good job rotating her pump insertion sites. Just try to use other sites like her thighs or the behind so you can avoid scar tissue for longer.
Thank you, Dr. Ahuja. We tried to discuss new sites, but Mia is not comfortable. She wants to keep using her belly or arms.
Why do I need to use other spots?
That is so that you don't form any scar tissue. Do you know what that means?
No, I don't.
Let me explain. When you scrape your knee or get a cut, have you noticed how the skin heals? Does it look the same as before?
No, it looks and feels different. I can't explain it, like a different color.
You're right. That is called a scar. It can fade over time, but the skin does look different. Now let's look at what happens when you wear an insulin pump. When you change an insertion site, the insulin pump tubing goes through your skin with the help of a needle. Insulin is steadily dripping through this tubing for the next 2 to 3 days until it is time for a site change. Insulin can cause fat tissue to grow. So if you keep using the same insertion sites frequently, the fat tissue under the skin in that place will keep growing. This is called lipohypertrophy and can appear as hard lumps on the skin. Rarely, the opposite happens, where the fat tissue can shrink in size. This is called lipoatrophy. This can appear as a small dent or a visible depression in the skin.
How do I monitor Mia for both?
Lipohypertrophy appears as hard lumps, soft, smooth raised areas about several inches wide. Sometimes it may be easier to feel than to see. The skin will usually feel firmer than the skin elsewhere on your body. Lipoatrophy looks like depressions in the injection sites where you feel the missing fat tissue. Now, sometimes you may hit a vein when you inject insulin, which can cause some bleeding and bruising. That is not lipohypertrophy though, because that resolves quickly.
Does it happen only with insulin pumps?
No, this can happen with insulin injections also, if you keep using the same spots.
Why is scar tissue not good?
If you insert the insulin pump tubing into scar tissue, the insulin is absorbed inconsistently. That means insulin does not get into the body immediately like it should. Some of it may get absorbed immediately, and some more may get absorbed hours later, or not at all. This can cause high blood sugars now and lows later, which can be confusing and sometimes dangerous. This variation in blood sugars, over time, can affect your diabetes control and your health.
What can I do to prevent it?
The best way to prevent scar tissue is to rotate sites. Use different spots for her insulin pump. These are the same spots she used when she was on insulin injections. If you already see lipohypertrophy or lipoatrophy, avoid that site. Also, check Mia's infusion sites regularly for scar tissue.
If I do get scar tissue, does it go away?
Yes, it can. The best treatment is to avoid the scar tissue for months, sometimes 6 months or longer.
Is it happening just to me? Or does it happen to others?
Mia, you will be surprised by how common this is. Lipohypertrophy happens in 3 out of 4 people with type 1. Lipoatrophy is far less common, seen in about 1 in 100 people with type 1 diabetes.
Dr. Ahuja, this was very helpful. Let's see if we understood everything. If we keep using the same sites for the insulin pump, scar tissue can form, which can be like lumps called lipohypertrophy, or depressions in the skin called lipoatrophy. This is very common, and can happen both with insulin pumps and insulin injections.
Scar tissue is not good because insulin may not be absorbed properly, and that can cause low or high blood sugars. I need to keep rotating where I put my pump so that I can avoid it. If I do get scar tissue, I need to avoid that site for months so it can heal.
You got it. Perfect.
We hope this gave you a better understanding of what is lipohypertrophy and lipoatrophy.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you for watching.